Apparently, everyone has taken the quiz. Just a little caution about the quiz. This happened this morning. So I sent an email out regarding accessing the quiz on time. So here's the thing. We designate periods when you can take the quiz. You only have 10 minutes before and after the time begins. Like in your classes, it's 2:30 to 4:30. 2:30 to 2:20 to 2:40 to access the quiz. If you go beyond that time, basically the computer shuts down, all right? So I actually checked a few individuals who claimed they tried to access the quiz. This is this morning, and they were trying to access it about 15 to 20 minutes after the deadline. So of course, they can't enter the quiz. It'd be unfair to actually have them take the quiz again when other people have actually abided by the time. So please try to stick with this time. Didn't happen this time, I think. I didn't look at the stats so far because you guys just took the quiz. Anyway, so try to be fair to every student. Please log in and out. Once you log in, you have 10 minutes to complete it. But please log in before the deadline, else you will not be able to you'll not be allowed to take the quiz, all right? So we're doing pretty good with that. That also applies to the exam, all right? Talking about exam, or exam 3 will be next Monday. So we're going to finish all the materials today for this chapter. This is chapter 14. Exam 3, as you know, will be on chapters 13 and 14. So I'm going to finish up this chapter today and maybe even start the chapter on viruses, which would not be included on this exam 3. Let me say a prayer and then we can start off. Heavenly Father, God, thank you so much for what you do for us. Help us to always be cognizant of the care that you put into us, each individual. And help our students to know that, again, I've said this so many times, they're the most important asset at Cal Baptist here. Whatever we're not doing efficiently, help us to know that. Help them to feel comfortable to let us know. Hey, Bideshi, or whoever, whatever professor is teaching them, oh God, that they should be free to literally express their opinions and their concerns. It's something that we do care about, something I do care about very, very much. I pray for them as they enter the second half of the semester. Time goes on pretty fast. With exams, keep them focused and help them to remember your purpose in life for them, oh God. If we have that, what could be more troublesome? Nothing at all, oh God. You give us grace and you give us a purpose. Help us to embrace it and to follow the tracks that you've laid for us. Everything should be easy after that. Yeah, I know there are difficulties with exams and all that stuff, but if we keep focused, oh God, if you promise us something, we know it will happen. Help us to be faithful to that plan. I thank you so much in Jesus' name. Amen. All right, guys, before I start lecturing today to finish this chapter, do you guys have any questions at all for me that I can answer real fast?
Professor?
Yeah, go for it.
I know you probably won't be able to do it today, but will you have a chance to go over the quiz questions? Because I was confused on one that I got wrong, and I just wanted to know if you're going to go over any of them.
Yeah, okay, so we have another quiz coming up at 5 o'clock, so I can't talk about the quiz until all the quizzes are done, even though they might be different from one section to the next, but there's a lot of things that are similar. So I can't actually address that, but remind me on Wednesday, all right? I'll pull the quiz up and we can go through the entire quiz. Is that fair game?
Yeah, that's fair. Thank you.
All right, cool, nice. Other questions? All right. So here's what I'm expecting on Wednesday. I want you guys to do a review of chapter 13 and 14. If you have any questions, go ahead and bring it up because, again, the next time I will see you guys, it's actually next Wednesday after that exam. All right, so write things down. Let me address everything that you have in mind. Don't leave on Wednesday without things being unaddressed, all right? Because, again, that exam is going to hit pretty fast on Monday. All right, so let me continue on with this chapter. Last time we talked about STDs. So we talked about bacterial STDs. We talked about diseases like syphilis. We talked about things like gonorrhea and chlamydia, and then a few others that we don't see a whole lot. For example, LGV, lymphogranuloma venereum, and then Donovan's disease. We also talked about Haemophilus ducreyi causing soft chancres. So all of that stuff was bacterial STDs. Here's the rest of the chapter. I want to say very few things about urinary tract infection. And then what I want to focus most of my attention on, it is what we call contact diseases. Many of those things we've seen before, for example, toxic shock syndrome, skin infections caused by Streptococcus pyogenes, So I'll just remind you about them. Just do a quick survey because, again, we've seen them before. Well, let's start off here with urinary tract infection, UTIs. Here's the things I want you to know, all right? Terminologies, clinical terminologies, and some of them are quite obvious. Again, we know this itis refers to inflammation of. Urethritis happens in both males and females. This is inflammation of the urethra. Cystitis refers to inflammation of the bladder. And I have these terms defined for you later on again. Prostatitis, of course, we see this in males. Females don't have prostates, right? So they don't have epididymis, but prostatitis is inflammation of the prostate gland. And then pyelonephritis, this is inflammation of the kidneys. Nephros refer to the kidneys, okay? So, but here's what I want to point out on this table for you. The top, if you take a look at the most common organism, doesn't matter what type of disease we're looking at, urethritis, cystitis, prostatitis, and pyelonephritis is caused by E. coli. So here comes E. coli again. It's a very prolific pathogen. And these E. coli strains, they come primarily from the intestinal tract, all right? So they are intestinal organisms. Yes, there are others, but top of the list, it is urinary tract infection. So I have this table again for you. It's always good to go back to the tables and names of disease, major organisms, signs and symptoms, same old story, right? Transmission. And then, of course, treatment, I don't ask you a whole lot, and prevention. All right, so let me just go through some basic anatomy of the urinary tract. Of course, we have blood. So this is blood that's circulating. The kidneys are filters for the blood. So here are your two filters. Blood is filtered. Of course, urine is produced. If you've taken 163, you should recall the urinary system. But again, we're not going to go deep into that here. Urine is produced by the kidneys. It's sent to the bladder through the ureters. So we have two ureters. They send urine to the bladder. And of course, from the bladder, urine leaves through the urethra and then excretion occurs. So basically, you void urine. So there are two ways to get urinary tract infection. One is from the blood itself. So imagine there's E. coli floating around the blood. Well, as they float around, as the kidneys filter blood, maybe the bacteria can actually enter in the kidney. So I can have a really major problem. That's pyelonephritis, all right? Most of the time, though, when we look at urinary tract infection, we get infected from the urethral passage. So basically, the urethra, they're invaded by the urethra. The urethra is invaded by pathogens or potential pathogens, get to the bladder. So ultimately, we have urethritis and then infection, cystitis, which is inflammation of the bladder. All right, so most of the time, this is what we're looking at. All right, now I want to just point out a few things that I'd like you to remember, all right? I already said one before, the most common organism isolated in urinary tract infection, males and females, is Escherichia coli, E. coli. Why? Again, keep in mind, E. coli is a natural inhabitant of the intestinal tract. Typically, when we see urinary tract infection, the organisms arise from the intestinal tract. That's the primary site, all right? So there are some normal flora that you find in the urinary tract from males, Corynebacterium, staph, and streps. There's some anaerobes back here, but generally these do not cause disease. So I don't want you to commit these to memory. E. coli, Staph saprophyticus, Klebsiella, Proteus, and Pseudomonas. They are the major ones that cause urinary tract infection. But again, E. coli, it is at the top of the list. All right? Now, another little fact. So this is one thing I'd like you to know, E. coli. Other facts I want you to remember, women are about 10 times more likely to get urinary tract infection than males. And again, there are two major reasons for this, all right? First of all, is the proximity of the urethra to the anus. So again, if you look at a female specimen, that's pretty close. Microorganisms have an easier time accessing the urethra compared to males in females. So that's one major reason. The second thing is this, right over here. The length of the urethra is pretty small. So once an organism actually gets to the urethra, it's easy to climb into the bladder to cause cystitis and urinary tract infection. All right, compared to the males, the urethra is pretty long, or it's longer than that of a female. So it takes organisms a longer time to get to the bladder. And also when males urinate, you're flushing out bacterial cells. So there are two major reasons why females are 10 times more likely to get urinary tract infection than males. First of all, it's the length of the urethra. Pretty short in females compared to males, pretty long. Also, the distance from the anus to the urethral opening is pretty short for females compared to males. About 50% of females would actually get a urinary tract infection at least one time. For some individuals, pretty unfortunate. You get multiple urinary tract infections per year. All right. Okay. So again, common risk factors, well, I list them here: sex partners, use of antibiotics. Think about this, birth control. We have a whole bunch of different things that may directly or indirectly link to urinary tract infections, primarily in females. All right. Now, more important is the signs and symptoms. So think about this. If you've had urinary tract infection before and it's a really bad one, you know some of these symptoms. There's painful urination. All right. There's a need there's a sensation to urinate more often. There's a feeling of course, urgency to urinate. There can be blood or pus in the urine. So some individuals, depending on the microorganisms, they can attach to tissues and degrade tissues, or they can be invasive, in other words. It's not unusual to see blood, and pus refers to white blood cells in urine. If it's pretty bad, a pretty bad case would give individuals have fever and chills, foul-smelling urine. All those are symptoms of signs and symptoms of disease, urinary tract infection. Even painful sexual intercourse. It can be so bad that people can have nausea, vomiting, and just general tiredness or malaise. All right. Now, let me just show you a few examples of urine specimen. These here, generally, this is what a urine should look like: a full color, maybe light yellow color. But take a look at this one. That's pretty cloudy. Right? That doesn't look normal at all. That was a urine specimen produced by a female who had an E. coli infection. So how do you actually screen this? Well, think about it. As nurses, you'd be collecting urine specimens on the patient. And then, of course, you send this to the laboratory. Now, last week, if you remember, we did something called a 4-quadrant streak. And that's important to isolate, as you recall, specific organisms, specific colonies that we can then work later on to identify them and test them against antibiotics. So that's done with urine cultures, don't get me wrong. But this thing is really important, all right? What you want to count is the number of bacteria present per mil of urine. That's called CFU. That stands for colony forming units. You take a calibrated loop. In other words, we know the volume you're placing on plates, and then you do a streak like this. Let me just draw the plate for you. Last time, this is what we did, a 4-quadrant streak, right? So you guys remember that pretty well. Terrible to draw with this one here. That's my 4-quadrant streak. In this case, you take the urine, and you actually streak in many different dimensions. So you're not looking for, you're not doing a 4-quadrant streak. You're just streaking like this. And then you incubate the organism, you incubate the plates, and you count the number of colonies. Generally, if the count is greater than 100,000, in other words, you count 100 cells here. See, the loop is calibrated. Every cell, every colony that you see really represents basically 1,000 cells per mil. And I don't care that you can do the calculation, but generally what you're looking for to define urinary tract infection, in most cases, you have to have over 100 colonies, which really represents 100,000 cells per mil of urine. So that's a lot of bacteria, all right? Okay, so again, just to remind you, gram-negative rods, it's Escherichia coli, top of the list. And then we have gram-positive cocci, Staph saprophyticus, but Staph aureus also an Enterococcus species. These are difficult to actually culture. They die pretty easily. So we don't actually screen for them unless the doctor says, you know what, everything else is negative. Can you screen for chlamydia and mycoplasma? And generally speaking, these are what we're looking at: gram-negative rods and gram-positive cocci. All right, and just here's the terms again: urethritis, inflammation of the urethra; cystitis, inflammation of the bladder; and then prostatitis, inflammation of the prostate glands. Pyelonephritis, again, nephro refers to the kidneys. So this is inflammation of one or both kidneys. And by the way, here are the organisms. I know you see different colors. The media itself has different types of chemicals in there. When specific organisms grow, they have certain colors. That's what the technology is like today. So E. coli will look pink. You can see this was streaked like E. coli. Pretty cool. Klebsiella, Proteus, Enterococcus, Saprophyticus, and of course, Staph aureus. So these are the top organisms that we find in males and females causing urinary tract infection. Again, don't forget it. E. coli is number one. All right. Okay, so I want to move away from E. coli infections, and then I want to talk about major contact diseases. So again, some of them you're going to see we've talked about already, so I'm not going to stress them. But here we go again. Here's a nice little table. And of course, it lists the most important things I'd like you to know, right? If you guys remember, we already talked about Staph aureus causing many different diseases. I'm going to mention a few of them today again. But remember, we talked about Streptococcus pyogenes and strep throat and erysipelas, rheumatic fever, toxic shock syndrome, necrotizing fasciitis. We're going to mention these again, but not do a detailed study of them. Right, so again, this is a pretty cool table. Names of inflammatory disease or inflammation and disease, agents that's responsible, signs and symptoms, and then, of course, transmission and prevention. All right, so let's look at the first group of disease. Major contact diseases of the skin. Now, first of all, let me just say this. Of course, there's bacteria that you find normally on the skin. And imagine, here's a microorganism, all these little red dots back there. Think about this. These organisms have to be very hardy. In other words, if you wash your hands, you're going to kill some of them with soap. Actually, maybe high temperatures, low temperatures can kill some organisms. If organisms are very fragile, they don't stay on the skin too long. So again, the ones that you do find on the skin, basically they're pretty hardy. They can withstand temperature, maybe even washing with soaps. Yeah, you kill some of them, but generally they tend to be very hardy organisms. Corynebacterium, Staphylococci, Acinetobacter, these are some examples of very hardy organisms you can find on the skin. Those are normal, all right? Now, of course, as we've been doing, we said, you know what? Let's look at each of these systems. Let's see if there's protection that we have naturally. Of course, we have natural protective barriers. The epidermis, if you've taken Bio 153, you talked about the integumentary system. That's the skin, right? So think about it. The epidermis up to about 200 layers of dead cells. That's a nice protective coat. There's keratin in these cells. There's something called an acid mantle. So that slight acidity actually helps prevent growth of other organisms. And when you sweat, there's salts and sweat. Salt can actually kill or inhibit the growth of organisms. There are other things that we find on skin, defensins. These are small protein molecules that can poke holes in bacterial cells and kill them. And then, of course, there are Langerhans cells or dendritic cells. These cells, they walk by and they pick up things that don't belong. They're like macrophages, actually. All right? Now, let's look at the two major forms. The first type of skin disease is caused by this organism. It's an anaerobic gram-positive rod. It's called Propionibacterium acnes. All right? But 85 to 95% of the human population would get some form of acne at some point in their life. Some people have more severe acne, others light, others maybe you don't even notice it, right? Now, here's the thing. This organism is just on all of us. It's present on our skin. Here's the reason why people have acne. It's just an immune reaction to the presence of that organism on the skin. So this organism doesn't break deep into tissues. It doesn't cause blood infections, generally speaking, unless somebody's an AIDS patient or something like that, immunocompromised. In general, it's just present on the skin. Some people have a stronger reaction to Propionibacterium, as you see back here. So now they have acne. And again, we can have several different scales, from severe to mild. All right? So just terminologies for you. When I say indigenous, that means it belongs on the skin. You find that there naturally. Again, why do people have acne? It's because their immune system is reacting to the presence of the organism. Now, terms for you. Comedones. You hear about pimples and blackheads and all that stuff. This is the technical term for it. An open comedone is called a blackhead. So again, imagine somebody has a pimple, it pops, oxygen can get into here. It's going to actually oxidize materials in that lesion. So it's going to ultimately appear as a blackhead, all right? Closed comedones, they're whiteheads or pimples. Okay, that's all I want you to know from this slide. Now, other terminologies you see clinically are papule, pustule, and nodule. And they're all exhibited right here on these drawings. A papule is a small, solid, round bump on the skin. Now, that can mean anything, right? It can be caused by microorganisms. It can be caused by chemicals. It can be caused by trauma, physical trauma to the cell. That's very different from a pustule. So again, think about it. Pustule, all right? A pustule is a lesion that's filled with pus. Remember why you have pus? These are white blood cells that attack bacterial cells. So again, pus indicates an infection, all right? A nodule is a hard spherical abnormal structure on the skin that you see. It can be very painful, all right? Anyway, so again, the most important one is a pustule. You see pus in the lesion, meaning there's white blood cells. Well, why are there white blood cells? It's because you have a bacterial infection. White blood cells go to that site to clean up dead tissue or other bacteria themselves, right? Now the next, so again, Propionibacterium acnes causes acne. That is the prime organism that causes acne. Now, other skin diseases are primarily caused by Staphylococcus aureus. Here comes Staph aureus again. I told you, E. coli and Staph, top of the list when it comes to infectious diseases, and they can be normal flora, right? So Staph aureus causes folliculitis. I'll show you pictures in a second. Abscesses, furuncles, carbuncles, and impetigo, among others. So typically, this is what happens. And by the way, Staph aureus can be normal flora in the skin too. But when it enters a hair follicle, it starts growing. It starts using nutrients in the hair follicle. And of course, what happens, white blood cells, they come from the capillaries back here to this site, and now you have pus. All right, remember, why do you get pus? It's because white blood cells are there attacking these organisms. So you remember Staph aureus, it's a gram-positive cocci. You can see this pretty nicely here, all right? It causes an infection in the follicles, hair follicles. White blood cells come by. No, it's pus. You see pus at these sites. So let's take a look at these specifically. So the terminology, number one, cellulitis. So what is cellulitis? Cellulitis is a diffuse inflammation of connective tissues. So here's a baby who has cellulitis. Let me just say, that can be caused by chemicals. It can be caused by physical trauma, but it can also be caused by bacterial infections. When it's bacteria, Staph aureus is like top of the list. All right. So again, we have abscesses. Here's a little kid with an abscess. An abscess is a circumscribed. All right, pretty round, pus-filled lesion. So again, there's infection going on in that abscess. And again, white blood cells come by, and of course, pus results from that. Now, a boil, the technical name for a boil is called a furuncle. These are deeper abscesses around the hair follicles. So that's a boil. It can be quite painful, actually. Now, imagine someone has multiple boils that are close together. They can interconnect, all right? When they interconnect, you end up with something that's more painful. It's called a carbuncle. So a carbuncle is a group of deeper connected furuncles or boils. Now, Staph aureus can also cause Ritter syndrome. All right, this is called scarlet skin syndrome. You probably heard about that before. It occurs pretty much in infants. The organism produces a toxin that causes peeling of a skin. So here's a baby with Ritter syndrome. You don't see that too clearly, but it looks like a sunburn actually, where the skin starts peeling off. And then the last one I want to mention here is impetigo infectiosum. So here's an individual, a certain area of the skin. You can see multiple lesions back here. That's impetigo contagiosum. And again, they're thin-walled. They look like little blisters. They can ooze a yellowish fluid. Of course, that's pus and bacterial cells. And then they can dry up to form this yellow-brown crust on the skin, like you see back over here. All right. But let me just say, most of the time they dry up, but the bacteria is still there. So these can reoccur several times. All right. So again, that's an impetigo contagiosum. All right. Now we know about this disease, toxic shock syndrome. So I'm going to say very little about this. Most common cause of, remember this, the most common cause of toxic shock syndrome is Staphylococcus aureus. So again, why do people get toxic shock syndrome? Is because this certain strain of Staph aureus can produce this toxin. So we talked about this before. That's TSST1, toxic shock syndrome toxin 1. So certain strains, not all Staph aureus can do this, but certain strains have the genes that code for this toxin. Remember that toxin is a super antigen. It hyperactivates the immune system. So again, the first time we saw toxic shock syndrome was in the early 80s. I came to this country in 1978, and I was a kid. I was 15 years old then. And then 1981, so this is 78, 2 years after, and then 3 years after 1981. All you're hearing on the radio, think about this time, you hear about COVID-19 now, right? But back then was this new thing that was occurring. This is about 40 years ago, right? Toxic shock syndrome. People were surprised because what caused that was Staph aureus. So the number one cause of toxic shock syndrome, it is Staph aureus. And here was the link. Women who left tampons in the vaginal tract too long. And just by chance, here's a strain of Staph aureus that produced this toxin, TSST, which is a super antigen. And a lot of women actually died because it was something new. We didn't know much about it. All right. Of course, on every tampon box, and if you're a young woman, you know this, you have to be aware of leaving the tampon in too long in the vaginal tract can actually lead to something. If it leads to something like this, toxic shock syndrome, if by chance you happen to have that strain in the vaginal tract. All right. So we already talked about this disease. I want to mention again, the number one cause of toxic shock syndrome is Staph aureus. Of course, Streptococcus pyogenes can also cause toxic shock syndrome. It's more lethal, but it's less common than Staph aureus. All right. So again, all I want you to know about this is the toxin is a super antigen. A super antigen hyperactivates the immune system. Ultimately, when death occurs, people recover, don't get me wrong. But in very terrible cases, what happens, people have hypotension. They lose a lot of fluid from the bloodstream. And of course, they have cardiovascular collapse, multiple organ dysfunction. And then, of course, what happens, a person can die. All right. Yes, by the way, one person emailed me, can males get this? Yes, males can get it. Of course, not through tampons, right? But they might have a wound. And just by chance, that Staph aureus strain that can produce this toxin is not present in the wound. So yes, males can get toxic shock syndrome too. So this is not primarily just related to just female infections. That's not true at all. All right. Next on the list with diseases, Streptococcus pyogenes. Again, as I mentioned to you, we spend a lot of time, tons of time on this organism here. When we looked at airborne disease, that was the first one we looked at. Streptococcus pyogenes primarily causes strep throat, right? So we have streptococcal pharyngitis, if you recall, pharyngitis right here, skin infections also, otitis media, middle ear infections, toxic shock syndrome. This organism can also cause toxic shock syndrome, necrotizing fasciitis. These are all diseases we've talked about before. Acute rheumatic fever, rheumatic heart disease, caused or induced by Streptococcus pyogenes. Right? So again, we talked about necrotizing fasciitis. I'm not going to say this much anymore. All right, we spent a lot of time on that. We talked about the virulence of Strep pyogenes, Streptococcus pyogenes. So I'm not going to spend much more time on this one. All right. Now, other things to be concerned about is wound infections, burn infections, very, very serious. And again, just to point out this, if you take a look at the list of the organisms, they're very common in many different diseases. So I don't want you to memorize the list, but I do want you to remember these are common organisms. E. coli, Staph aureus, Enterococcus, we've seen them before. It's the same old thing over and over again. So these are the prime organisms that cause wound infections, right? Now I'm going to be a little more specific now. Animal bites. Top of the list is an organism called Pasteurella multicida. It's a gram-negative rod, stains coccobacilli. But again, here's why this is so common. If you were to take a swab of, say, saliva from dogs and cats, it's easy to isolate this organism. Imagine somebody being bitten, right, by a dog or a cat. It's not unusual to find this organism in the wound, in that bite wound. So again, for animal bites, top of the list, all right, Pasteurella multicida causes pasteurellosis. Another disease is called cat scratch fever. All right, there's a song named Cat Scratch Fever, of course. You're probably too young to know that. Maybe some of you heard that. In any case, Ted Nugent, doesn't ring a bell. Okay, so I'm aging myself back here. That was maybe late 70s, early 80s, 1980s, that is. All right. But the organism, what people believe most now causes this disease is Bartonella hensleyi. That's a rickettsial organism. You guys remember rickettsia? Rickettsia are obligate intracellular parasites. So they're very difficult to culture. But nonetheless, this one causes angiomatosis. In other words, there's a tumor of blood vessels, of cells that form blood vessels, all right? So again, Bartonella, what I want you to know, Bartonella hensleyi is the leading candidate that causes cat scratch fever. So pasteurellosis caused by Pasteurella multicida. We have cat scratch fever caused by Bartonella hensleyi. which is a rickettsia-like organism. All right, now moving on, rat bite fever. So we had cat scratch fever, I know. Now we have rat bite fever. Of course, what that tells you, the animal that has this organism, it is rodents. In this case, it's a mouse. All right. So the organism that we care about, so don't worry about this one. We see this primarily in Asian countries, but the one we see in the United States is called Actinobacillus murus. It used to be called Streptobacillus moniliformis. Anyway, it's a gram-negative rod. People who have rat bite fever, they often demonstrate a triad of symptoms. So this is 3 different types of symptoms that you see in the same patient. Sometimes you see a rash, skin rash. That doesn't show up too well, but you can see these spots back here. All right, that's a skin rash. They have back and joint pains and a prolonged fever. It can be so with many different rash diseases, but nonetheless, this one is caused by Actinobacillus murus. Now, the other disease I'm going to spend a little more time on is leprosy. Now, leprosy is like an ancient disease, right? You've heard about that. You read about it in the Bible if you read the Bible. So it seems to be a very ancient disease. Let me just say this right off the bat. Most people are actually immune to this organism. About 95% of the world's population. In fact, I tell you that right here. You can't get leprosy. You can't, all right? Because you have natural immunity to it. All right, so what causes leprosy? Again, let's go back to the laboratory. Remember we talked about acid-fast organisms? So the very first thing that should pop into your mind is mycobacteria. Think about Mycobacterium tuberculosis, africanum, and bovis. They cause leprosy, right? No, they cause tuberculosis. We also talked about leprosy caused by Mycobacterium leprae. So Mycobacterium leprae causes leprosy. Leprosy is primarily a disease of the skin and the peripheral nerves. Don't forget that. So 2 different types of tissues, skin and then peripheral nerves. All right. Okay, so if you just some stats, I don't test you on stats, so you don't have to recall these numbers, but it's estimated that there are about 10 million cases of leprosy, primarily in India, actually, of leprosy worldwide. Very few cases in the United States. The estimates are as low as 3,600. I mean, for the whole population, to about 7,000 or so. All right. So again, just a couple of things I'd like you to know, just some general things about this organism. It can't be cultured. You can grow E. coli in the laboratory, but for Mycobacterium leprae, we can't culture this organism. That's one thing. It grows best around 30 degrees centigrade in tissues. That's why you find it on the skin, primarily, and peripheral means on the outside. Peripheral nerves. You don't find Mycobacterium leprae causing deep-seated infection. Why? It can't grow at the body temperature 37. It has a very hard time to grow. So it grows very slowly. Generation time, it's about 12 to 14 days. It's a very slow-growing organism. So this is a chronic disease. Don't ever think you're going to have an acute disease if you've been exposed to leprosy, Mycobacterium leprae, and you're in the 5% that can get the disease. That's a fulminant disease. In other words, you expect to see that within a week. Doesn't happen with leprosy. It's a slow-growing organism. Takes a long time, maybe 3 to 6 years. This is the incubation. That's a very long time. All right. Now, a couple other things I'd like you to know. The organism does grow in the foot pads of armadillos in the wild. You capture armadillos. It's not unusual to find Mycobacterium leprae on the foot pads and also on mice. All right, so again, is this a source for infection? In other words, is this a reservoir? People are not certain about that, even after all this time. So again, there's a possibility that humans can be infected through transmission from animals. That's called, as you know, it's called a zoonosis. Zoo refers to animals. Transmission of disease from animals to humans. We've seen that a couple of times now. It's called zoonosis. All right? Okay, so what I want to focus on really is the 2 major forms. And I have a table back here, but I'm going to go through each of these with you. So there's a form called the tuberculoid form and a form called the lepromatous form. Let me just say, when you think about leprosy, this is the form that you tend to think about. That's the lepromatous form, right? This is the infectious form of the disease. And then, of course, the tuberculoid form of the disease looks like this. So I can take this table and talk about this very specifically. Let's go for a few things before we actually get to the 2 different types. So leprosy, again, is a disease of the skin and peripheral nerves. So what about the nerves? All right. the organism can actually infect Schwann cells. So that's what I'd like you to know. Schwann cells can be infected. If you recall, here's a neuron. Here's the axon. If you have a group of cells, Schwann cells that wrap around the axon. So I'm pretty sure you remember that from 153, right? If you've taken 153, this organism can actually infect those cells. All right? It requires something called PGL. It produces PGL. That stands for phenolic glycolipid 1 to cause infection of those Schwann cells. And that's all I want you to know from this slide. What I really want to talk about is the two major forms of leprosy. The first type is called tuberculoid leprosy. It's also called paucibacillary leprosy. Now let's decipher the terms. Pauci means little or few. So this is the non-contagious form of leprosy. So individuals who have this form, typically they have less than 5 lesions on the skin. This is what it looks like, all right? If you try to find the organisms in the lesion, it's very difficult. In fact, you find very little organisms or even no organisms in the lesions themselves. Here's the reason why. These individuals are actually immune to the organism, so it's not growing very rapidly. It's not growing at all in tissues in any big way to cause infection, to cause transmission. So they are naturally immune, all right? If you were to remember when we did TB, we talked about a TB skin test. These individuals would actually have a positive skin test for leprosy. The reason why is because they have immunity to it. This is the non-contagious form. So the non-contagious form, because there's very few organisms, little or no organisms in these lesions that you can detect, is caused by a tuberculoid leprosy, very few bacteria in the lesions. Their skin test would be positive. So these are the things I want you to take over from the slide. Tuberculoid leprosy is also called paucibacillary leprosy. All that means is very few organisms in the lesions. People typically have less than 5 lesions on the skin, as you see here. This is the non-contagious form. Why? You have very few organisms to begin with. And then people who have this form, generally, they're immune to the disease. All right? And again, here's some examples. By the way, this one here, the reason why it looks so bad is because you have secondary infections. Typically, when we look at secondary infections, that's a bacterial infection. Staph aureus or something like that. All right. Now, this is the form you're probably more familiar with. It's called lepromatous leprosy. It's also called, check out the term, the first one, tuberculoid, was called paucibacillary leprosy. The term used for this one is called multibacillary leprosy. In other words, there's tons of pathogens that you find in these lesions. So again, this is the lepromatous form. These are the lepromas, right? So again, if you were to cut that tissue and do an acid-fast stain, remember mycobacterium, the acid-fast stain, notice this? You see tons of that red staining bacteria. It's just loaded with the organism that causes leprosy. These individuals, they're not immune, so their skin test would be negative, all right? So their leproman skin test, because they don't have immunity to it, that skin test would be negative. This is the contagious form. Remember I said to you about 95% of the world's population, they're immune to leprosy. They won't get the disease even if they touch the patient likeness. But even if you're in the 5% who's that unlucky, then this could be the contagious form, all right? Okay, so how do you get this? Nobody really knows, but many people think it's through respiratory droplets, mucus secretions. So that's a growing thought, but there might be multiple ways by which individuals can get this disease. All right, so this is lepromatous leprosy. You see many different lesions back here. There are 2 major forms. One is called diffuse, and the other is called nodular. So let's take a look at the first type. This is the nodular form. Those are the nodules that you find on the skin. That's typically, when you think about leprosy, that's typically what you're thinking about. But this is the diffuse type. You see multiple lesions here. These individuals, they have, if you actually take a sample here and do a smear or a skin scraping and do a stain on it, you're going to see tons of organisms, all right? Individuals are typically, this involves the forehead, right? And of course, the eye. For some reason, people with leprosy, this diffuse form, they tend to lose their eyebrows. So again, we have the lepromatous leprosy is called multibacillary leprosy. This is the contagious form. Individuals who have this form, they're not immune. So their skin test would be negative, all right? If you're in the unlucky 5% of the world's population, you can get this disease from these individuals. All right? Now, I don't ask you to remember treatments, except I said if I tell you. So I want you to know vaccines for sure, but I do want you to know one treatment that we use for leprosy is this word here. So don't forget dapsone. Dapsone is an antibiotic that we use to treat people with leprosy. And again, because resistance is developing, you just don't use one antibiotic. You use combinations of these. So these are the important ones here. But really, the one I want you to remember is dapsone. I'll show you how significant this is, all right? So here's a kid, as you can tell, he has lepromatous leprosy. You can see not less than nodules on the skin, all right? Here's the cool thing, this was caught on time. If you're in this stage here, what I just showed you earlier, that's pretty well advanced. It's very difficult. In fact, you can't. You can't rid this person of leprosy because it's too advanced. Now, here's a kid, all right, who has lepromatous leprosy, and he was given dapsone. Well, in 6 months, here's what happens. Take a look at this smile. Imagine a life confined, just psychologically, and all this stereotypes that's associated with leprosy. Imagine an individual. It's always good to be empathetic with people, all right? Be compassionate. We talked about that on the very first day. Imagine someone who has this disease confined for life like this, all right? Think about the social impact, the socioeconomic impact, the psychological and mental impact. I can't imagine going through something like this. Now, this is what this kid would have ended up like if he was not treated. So again, he was treated with dapsone, and in 6 months, see that smile on his face? Every time I see this picture, I say, wow, dang it. If everybody can be treated as early as possible for leprosy, this won't be a problem. All right, we have pretty effective drugs that we can use in combination. Top of the list is dapsone, so don't forget that. All right, this is just to show you. This is a skin biopsy stained with, guess what? That acid-fast stain that you did in the laboratory. You see these acid-fast organisms? This is from lepromatous leprosy or multibacillary leprosy, tons of bacteria and tissues. So again, this is just a very small section, a couple of microns, maybe about 50 microns or so. Tons of organisms that you see here. So again, these lesions, all right here, if you were to do a skin biopsy and do a smear, an acid-fast smear, this is what you would see. You would not see this with the tuberculoid form of leprosy. Very few organisms, or none that you can detect by a stain like this. All right? Okay, the last section I want to talk about here, it's eye disease. All right, this is infectious bacterial eye diseases. You can hear the specific terms, blepharitis, also called a STI. You've probably heard that term before. Conjunctivitis, and these are all bacterial diseases. Now, we're not going to put viruses here. Neonatal conjunctivitis, we saw this before. Remember when we talked about gonorrhea and we talked about chlamydia? We said a baby who's born to a mother who has gonorrhea or chlamydia, they can get this bacteria in the eye and they can end up with conjunctivitis. So we've seen that before. And then something you probably haven't heard about before, trachoma. Trachoma is also caused by Chlamydia trachomatis. Think about the term trachoma, right? But a different serotype or different serotypes. This is A through C, all right? So remember D through K, Chlamydia trachomatis D through K, those serotypes can cause the STDs, right? Then we looked at lymphogranuloma venereum. This is, what was that? I think it was, L1, L2, L3. So those are the serotypes that cause LGV. That's another sexually transmitted disease. Here's another disease. It's called trachoma. Trachoma is an infection of the eye caused by Chlamydia trachomatis, but not the ones that cause STDs. These are the ones that cause trachoma. Of course, they're serotypes A and C. So again, here's the table. Here's this table to list the disease, causative agents, signs and symptoms of disease, transmission, and then prevention. Don't worry so much about treatment here. All right? Let's look at conjunctivitis. The conjunctivitis, of course, is a membrane that lines the eye. Typically, common name would be pink eye. You probably heard that term before. All right? Primary agents, Haemophilus influenza, Neisseria gonorrhea with the STDs, Chlamydia trachomatis. Here we go again, Staph aureus. So these are the top organisms that cause conjunctivitis. And here's an individual you can see with inflammation of the conjunctiva. All right? So again, those are the top organisms that we see. Now, a STI, also known as a hordeolum, all right? These are infections of the oil glands of the eyelids. So you can see one infection here. Here's another one. Another one's popping up here. Here's a big one. In fact, multiple oil glands are actually infected. The primary organism, check it out, Staph aureus. Here comes Staph aureus again. And again, these can be normal on the skin, except it gained access to a site it doesn't belong in. And you can see actually pus building up here. So this is when white blood cells come to that site, they mount an immune response. If you pop that, it will be pussy in appearance. So these are pus that produce pus because of the white blood cell coming to that site, all right? Okay, now last on the list for eye disease is trachoma. And before I actually get to the disease itself, take a look at the planet right here. Most cases occur in the southern hemisphere, all right? You see big problems here in Africa, Southeast Asia, India, China, Australia, South America, Brazil in particular. So we tend to see a lot of these diseases. Let me just say about 241 million people are at risk for this disease. As far as visual impairment, about 1.2 million. Those have become permanently blind because of trachoma. It's about 1.2 million. Very easy to treat, but you have to catch it on time, all right? So here's the people in the different stages of becoming blind. All right, so major visual impairments back here. In this case, that person basically legally blind. This is what you see under the eyelids and in the conjunctiva. So you see these nodules that let me go up to this first slide. See, this is typical conjunctivitis. See how smooth that is, bloody and inflamed, but smooth. When you get to trachoma, they have these little nodules that you find on the tissues. Very painful. Imagine somebody's trying to close their eyes, but there's nodules that actually causes pain. All right. So you find this primarily in hot, dry climates. Again, it's trachoma, trachomatis, chlamydia trachomatis, serotypes A, B, and C. Those are the most important ones. How is it transmitted? Through fomites. Again, we saw that word before. These are inanimate objects. And again, from person to person. All right. So important thing, conjunctivitis with nodules. Very different from your typical conjunctivitis. All right, so we're winding down. We talked about Treponema pallidum causing syphilis. There are some other species of Treponema pallidum and subspecies that cause different diseases. For example, Yaws is caused by Treponema pallidum. Bejil is caused by Treponema pallidum endemicum. And then Pinta is caused by Treponema karateum. So again, if you remember syphilis, we talked about gummas, right? These kind of look like gummas. All right, that's like tertiary syphilis. But again, that's a separate disease. If ever you do a mission trip in South America, places like Brazil, and you see lesions like this with a purplish blue coloration around it, that disease is called Pinta. Not so uncommon, all right, in places like Brazil, South Central America. All right, and that's it. So again, literally, the organisms we talked about before, many like Staph aureus, Streptococcus pyogenes, and Clostridium difficile causing pseudomembranous colitis. But that takes care of this chapter. This is chapter 13. All right. Okay, guys. So we just concluded with chapters 13 and 14. This is the topic for your exam 3 on Monday. All right. Do you guys have any questions on this chapter? Something I can answer real fast for you? All right. Okay, so tell you what, I'm going to start talking about chapter 15. This is on viruses on Wednesday. All right. So that's posted on Blackboard this morning. You probably haven't printed that yet, but we're going to pick up on that chapter on Wednesday. And of course, on Wednesday, here's what I want to do also. Most of the time I'm going to be spending on that lecture, so you have a lot of time. We're doing pretty well with time, actually. But I do want to do a review with you for exam 3. So again, please bring by all your questions on Wednesday. I hope I can answer them all. All right? Okay, since there are no more, yeah, go for it. Yeah? That's a very good question. So you're right. You have to be concerned about that, especially with things like warts. That's caused by papillomavirus. Imagine people are digging into the warts because it's itching or whatever, and then they're touching other parts of the body. So yeah, you can transmit agents that way. Staph aureus, you can do the same. Basically, any infectious agents you can cross transfer. You have a lesion somewhere, you touch that, and then you touch other part of your body. That can be a problem. Even with herpes. So again, sometimes people with genital herpes, they end up with herpes in the eye. All right. Because why? They touch one part of their body and they transmit that to somewhere else, or they transfer it to other parts. So yeah. All right. All right, guys, don't feel bad if you want to leave. I already have your attendance. But if you have other questions, I can hang around for a few minutes to answer them.
Thank you.
All right, guys, have a good one. I'll see you on Wednesday. Again, come with your questions. I want you guys to start thinking exam 3. This is next Monday. 2 chapters only. Said that like 50 times, right?